Let me begin this section by introducing each of you to the core concepts of the Cognitive Hypnotic Psychotherapy approach. Here, CHP thrives on the seamless integration of diverse therapeutic approaches, ensuring a harmonious blend of conscious and unconscious processes. One distinctive feature is our utilization of hypnosis, not as a means of controlling mind, but as a bridge that connects various therapeutic methods. The primary goal remains solution focused, with the client placed squarely at the center of our endeavors. We adhere to a structured yet flexible framework known as SOFT-C, a framework that we will unravel as we progress. Another key concept that we will discuss revolves around the multi-layered nature of problems. From a psychotherapeutic standpoint, we have addressed a myriad of issues through our methods, providing a comprehensive solution. Let us go deeper into each of these concepts now. Starting with seamless integration. What does this really mean? Is it about switching techniques from one session to the next? No, not really. Seamless integration in this context means blending of therapeutic methods within a single session. For instance, you may initiate a session with the goal of helping a client overcome anxiety through cognitive behavior therapy thought restructuring. However, as the session unfolds, you might discover that the client struggles to recall the specific triggers or anxiety-inducing thoughts. In such a situation, you can seamlessly transition to employing hypnosis. This allows you to regress the client back to the moment just before they experience anxiety. You can introduce mindfulness suggestions to aid the client in recognizing the triggers and anxiety-provoking thoughts. Following this, you can use suggestions to explore desired emotions and thoughts. Once the client identifies these new emotions and thoughts, you can employ neuro-linguistic programming anchoring techniques to solidify the positive emotions. Lastly, you can engage in future pacing within a hypnotic state. In this state, the client is exposed to the same trigger but with the new restructured thought, all the while experiencing the new anchored positive emotion. This example demonstrates how seamless integration really works. Since each client is unique and their needs vary, this approach empowers you to create and apply integrations that are tailored to each client's specific requirement. This is amazing, isn't it? Just take a moment to consider the transformational impact of integrations on your clients and the joy and satisfaction that you will experience when you notice these transformations in your client's life. You will understand the nature of these integrations more intricately once we go into the details about the SOFT-C framework. For now, let's shift our focus to the next core concept, the interplay between the conscious and the unconscious mind. The conscious mind, responsible for logical reasoning and decision making, engages in activity that demands deliberate choice and effort. On the other hand, the unconscious mind stores memories, shapes beliefs, influences emotions, and governs our automatic behavioral patterns. Here is where cognitive hypnotic psychotherapy steps in. Our aim is to assist clients in accessing and working with their unconscious mind, aligning it with their conscious choices. To be honest, when it comes to different approaches to therapy, even those claiming to be solely focused on the conscious mind are essentially after the same thing. I see requests for examples on the chat. Here's how it works. When a client seeks therapy, they are looking to make a change, but they are struggling. No one says, I love smoking and I want to keep smoking, so help me out. Instead, it's more like, I want to quit smoking, but I just can't. Or someone might say, I feel anxious, but I really don't want to feel this way. So, clients are telling us that they consciously want to change, but something is holding them back. This something isn't a conscious choice, right? So, you could say that this something that is holding them back. In other words, the underlying issue lies at the unconscious level. In the end, therapy, no matter the approach, is all about bringing that conscious and unconscious alignment into play. It's with this understanding that we found ways to blend various psychological approaches together. Now, you may wonder, how do we do that? We use hypnosis for the same. But wait, what is hypnosis? Contrary to popular perception, hypnosis is not about taking control of someone's mind. Instead, it's about helping them do what they want to do but are struggling to achieve. Let's break it down with an example. Picture someone who sets an alarm to wake up in the morning but still struggles to get out of bed when it rings. They consciously want to wake up but can't make it happen. This is where hypnosis comes into play. It's a tool to make the client more receptive so that you can align the unconscious with the conscious mind. Now, back to the smoking example. If someone says, I smoke and I want to keep smoking, hypnosis won't be of any use. But if they say, I smoke and I want to quit, but I can't, that's where hypnosis can work wonders. It helps the unconscious get on board with the conscious decision, making quitting faster and reducing the chances of relapse. So to clarify, hypnosis is about making the unconscious more receptive. It's like getting both parts of the mind on the same page, either by aligning the unconscious with the choices or by understanding why the unconscious is doing what it does, so change can happen. Another important thing to consider when it comes to hypnosis is that hypnosis can be defined as both a state and a process. In the hypnotic state, the client is hyper-receptive, making them more open to change. On the other hand, any process that leads the client to a highly receptive state is really a hypnotic process. This distinction matters because while everyone agrees that a receptive client is better, not every hypnotic process suits every client. The key is to find the right process for each client. Not every method works for everyone, and that's where your skills as a practitioner comes in. So, hypnosis as a state is universally accepted, and the goal is always a receptive client. The real skill is figuring out the right process for each individual client, which brings us to the next misconception, that hypnosis doesn't work for everyone. In the past, therapists used to use a very direct way to put people into a hypnotic state. They would say, sit comfortably, close your eyes, take 3 deep breaths and notice your breath becoming deeper. Now, if you are someone who takes things very literally, you would follow these instructions and you would be called hypnotizable. But some folks are analytical thinkers. So when they hear, close your eyes, take 3 deep breaths, your breath is becoming deeper, they start questioning, how do you know that my breath is becoming deeper? They are not really following the suggestion because they are too busy doubting it. This doesn't mean that they can't be hypnotized. It just means they need a different approach. So, for these analytical thinkers, you might say most people, when they pay attention to their breath, notice their breath getting deeper over time. You have already answered their question in advance. They think, well, if most people experience this, maybe I will too. This helps them relax and give the suggestion a chance to work. So, to sum it up, hypnosis can work for everyone. You just need to find the right approach for the right person. It's about tailoring the process to the individual. I see a question in the chat about where hypnosis should not be used. Think of it this way. Hypnosis is all around us, whether we know it or not. Take the example of watching a movie. You know the actors are just acting, but you still get emotionally involved. That's because the movie taps into your unconscious, bypassing your analytical thinking, thereby creating a hypnotic state. So it is not really about whether to use hypnosis, but more about knowing which technique not to use in what situations and with what people. For instance, using guided imagery may not work well with someone who experiences visual hallucinations because it might make things worse. Or consider relaxation techniques. If someone has low blood pressure, relaxing them can actually make them anxious because it can lower their blood pressure further. But if you were to pay attention, you would realize that these are not really the limitations of hypnosis, but of the techniques to use for inducing the client in a hypnotic state. I also see questions in the chat about hypnotherapy and guided meditations. Before I take these questions, let us summarize the key takeaway about hypnosis. So hypnosis isn't about controlling the conscious mind or making people do things against their will. It's a way to work with willing clients who want to make changes by making the unconscious mind more receptive and aligning it with their conscious mind. Moving on to hypnotherapy. Honestly, we don't quite buy into the idea of hypnotherapy as a separate, distinct form of therapy. In our view, it's essentially hypnosis plus therapy. You take the hypnotic state and blend it with any therapeutic practice, and you've got hypnotherapy. It's not an entirely different field. It's about implementing the therapeutic processes in a hypnotic state. Now, many institutions offer hypnotherapy courses, but what they are essentially doing is teaching you hypnosis and throwing in some therapeutic techniques that work well with it. The thing is, they might not explicitly explain this to you. Why are we pointing this out? Because we want you to see that hypnosis isn't confined to a specific therapeutic technique learned in a particular course. Whenever you have learned a therapeutic approach, with a bit of creative thinking, you can integrate it with hypnosis. Take our Cognitive Hypnotic Psychotherapy course, for instance. While we cover only a few art-based therapy techniques, some participants who have trained separately in art-based therapy tell us they seamlessly have integrated these methods. How? Because they don't see hypnotherapy as a standalone field. They see it as hypnosis plus therapy. As far as guided meditations are concerned, by definition, guided meditations are a form of hypnosis. You are guiding someone through an experience. This experience is being created in the person's mind with the help of suggestions that they are able to accept. If that is not hypnosis, I don't know what is. I know there are people who would suggest otherwise, but that is simply because of lack of understanding about what hypnosis really is. The point here is to broaden your understanding of hypnosis beyond the traditional view. To help you expand your understanding of hypnosis, consider how even news channels, whether knowingly or unknowingly, use elements of hypnosis to influence opinion. Your stance on a government policy might be shaped by the news channel you frequently watch. While we explore all of these applications of hypnosis, remember, during the course our primary focus is on helping you master its application in therapy. Now, before we go ahead, let me check the chat once again for all the questions related to hypnosis and see whether I have answered all of them. While I check, do go ahead and let me know whether you are beginning to see why hypnosis provides you with almost like an unfair edge over other practicing psychologists. Once again, thank you for the large number of responses. I think I have covered all the questions related to hypnosis from the chat. In a nutshell, we use hypnosis to build a bridge between the conscious and the unconscious. We aim to understand and address the unconscious responses that hinder clients from making desired changes, making the change feel more natural and automatic for them. This, in essence, is the power and purpose of hypnosis. Let us move forward and explore the next core concept of our approach, which is structured yet flexible. Considering the vastness of the Cognitive Hypnotic Psychotherapy approach, keeping track of all the techniques, their indications, counterindications, and steps can be overwhelming. So we designed a tool to make it easier for practitioners, the Soft C framework. Think of this framework as a blueprint. It provides well-defined, broad steps, and here's the beauty. Within those steps, you have the flexibility to choose from various techniques. It's not a one-size-fits-all situation. You might start with one technique and seamlessly transition to another. I'll share a few examples shortly to illustrate this. The goal of this approach is to ensure you never feel lost during the therapy session. As you work with a client, having this blueprint allows you to offer a personalized experience while having a structured guide at your fingertips. As I walk you through the model, you will notice that this framework is versatile enough to be applied with any therapy approach you currently explore. However, its real magic unfolds when integrated with the Cognitive Hypnotic Psychotherapy approach. Now, let's quickly go through all the steps of this framework, starting with defining the current situation. We use a simple format: I feel dash, about dash, when dash. Why this format? Well, any client seeking therapy usually has three components to their problems. There's a feeling that they are uncomfortable about. The feeling is related to something or someone, and this discomfort surfaces at certain points in their life. Traditionally, therapists would conduct extensive interviews to figure this out. We have streamlined this process. We work in a way where the client defines this themselves. We still conduct an elaborate interview, but they are more structured. The Soft C framework acts as a blueprint, making the process more efficient. Having said that, there are times where the client may not be able to fill in the required blanks. And these are the places where you truly begin to appreciate the beauty of the Soft C framework. First, some clients have a lot to say, making it hard to structure their problem. This is where the I feel format helps. Clients express themselves, and through questioning tools like meta model questions, we help them summarize and structure their issues. The second scenario is when a client isn't sure where to start or feels uneasy sharing. Here techniques like abstract metaphor and transformational metaphors come in. Clients explore their problems metaphorically, making them more comfortable. We then help them connect their metaphoric story with what is happening in their life currently, eventually bringing them back to the I feel dash, about dash, when dash format. Notice how even at the initial stage, we identify possible client challenges and tailor techniques accordingly. Now, once the client defines their current situation, we move to helping them define their desired outcome. We use a format called I wish dash. The I feel statement becomes the reference point for creating the I wish statement, as the I wish statement is often the opposite of the I feel statement. But the I wish statement has to be about the client, which means if a client says, I wish my partner listens to me, this isn't the wish statement we can work with, as the partner isn't in therapy. So we redirect the focus by asking the client, what do you need to do to increase your chances of your partner listening to you? Now, the client may reframe the wish statement by saying, I wish I can understand my partner better and articulate myself in a way in which my partner understands me or listens to me. This shift is crucial. We use soft C questions and meta model for this transition. Once the client shares their desired outcome, the next step is to delve into the future they envision based on this outcome. Why is this crucial? Well, clarity is the key. Clients might initially believe that achieving a specific outcome will lead to a desired future. But upon closer inspection, they might realize a miscalculation, leading to disappointment. To prevent this, we encourage the client to describe their future during the discussion. The future can't be abstract. It needs to be specific, observable, and tangible. We use tools like the miracle question from solution-focused brief therapy in combination again with meta-model questions to help clients articulate this future clearly and effectively. This clarity serves another purpose. It becomes a reference point to gauge the effectiveness of therapy process. The sensory specific elements the client describes acts as a marker. When these things start happening in their life, it reinforces the value of therapy, motivating clients to continue. After the client has shared their vision of the future, we move on to an essential aspect, understanding the tasks they will need to perform and the triggers that they need to address to achieve that future. These triggers often relate to uncomfortable emotions. For example, a client may have experienced anxiety, which hinders their ability to carry out specific tasks. Our goal is to identify these triggers and help the client change their association with them. For instance, if a client mentions that they become anxious when typing the topic of an article they need to write, the trigger here is the act of writing the topic. As long as this trigger causes anxiety, it will be challenging for the client to proceed. Our job is to identify these triggers and tasks, and if needed, we can utilize methods like meta-model questions to help the client express this more effectively. In cases where the client is unaware of their triggers, we can combine hypnosis and mindfulness with guided discovery to assist them in recognizing these triggers. Once these triggers and tasks are identified, they fall into two categories. The first category consists of triggers and tasks the client believes they can manage on their own. While we list them for reference, our primary focus shifts to the second category, triggers and the tasks that the client struggles with. Now, that the client knows these tasks and triggers, why would they still struggle with them? There are various reasons that can be the cause of the client's struggle, and it is to understand these causes that we will need to explore the different layers of a problem. The initial layer often involves a lack of clarity, skills, or resources. Imagine someone wants to manage their weight and they express, I don't even know what steps I can take to manage my weight. This is lack of clarity. Some might say, I know I need to go to the gym, but I don't have the resources to go, indicating lack of resources. Others might mention, I went to the gym, but there's no instructor in the gym and I'm not sure how to use the equipment. This points to lack of skills. So, the first layer involves addressing these gaps in clarity, skills, and resources. The good news is these are tangible issues. If there's a lack of clarity, steps can be taken to gain a clearer understanding. If resources are lacking, efforts can be made to build resources. If skills are missing, there is room for developing skills. While it may take time and effort, it's achievable. This process often circles back to adding more tasks to the client's list. However, sometimes the challenge isn't the tasks themselves, but the mental state hindering their execution. Mental state is the next broad layer, which is then further divided into sub-layers. The first sublayer in mental state involves our ongoing thoughts and feelings. Consider the scenario of waking up in the morning again. Many of us can relate to setting an alarm with the intention of getting up early. However, when the alarm goes off, the initial thought might be 10 more minutes, coupled with a feeling of lethargy. As a result, the hand instinctively crawls out of the bed and reaches for the snooze button. Imagine if we could assist individuals in recognizing these thoughts, reshaping them and altering their feelings. What if instead of thinking about extra sleep and feeling lethargic, the first thought upon waking was about something exciting to look forward to? This is achievable through a combination of cognitive restructuring and anchoring in a hypnotic state. Sometimes feelings are so intense that standard approaches don't suffice. Techniques like systematic desensitization or aversion therapy might be considered, but they come with their own limitations. Aversion therapy can be risky and often lacks long-term impact. Systematic desensitization is challenging because it guides the client through a relaxation process while systematically exposing them to their triggers. The situation arises when, in real-life situation, the client is confronted with the trigger before they've had a chance to relax, and their anxiety or fear has already kicked in. But by combining systematic desensitization with hypnosis, you first condition the mind to relax almost instantly. You establish an association between the phobic object and the relaxation. This reconditioning makes the entire process much more effective, with behavioral therapy possibly adding cognitive restructuring on top of that, which yields significant results. However, there are instances where there might be too many repetitive thoughts and feelings, or where the feelings are so intense that working directly with them isn't sufficient. In such cases, we need to move to the next layer, which involves beliefs, values, and positive intentions. While beliefs and values are pretty straightforward concepts, let me share an example of beliefs to give you a clearer picture of the kind of work we are discussing. I had a client who was committed to managing their weight. They were diligently exercising, and the gym instructor even said they couldn't do more without risking health problems. The client was also following a diet plan, but the dietitian was puzzled why the weight wasn't coming under control. This led the client to seek help from me. After some initial work, we realized the client was doing all the necessary tasks, yet the body wasn't responding. That's when we delved into exploring underlying reasons and beliefs came into play. The client recognized a belief, Marwadi khate peete ghar ke hone chahiye, roughly translating into people from Marwadi community should not only be wealthy but should also appear to be wealthy. Waist size is one indicator of the person being well fed and wealthy. It may sound amusing, but this belief was significantly affecting their weight. Using a process, we helped the client break free from this belief. The result? Without changing anything else in their routine, just by addressing this belief, their weight came under control in the following months. I am going to wait for a moment for you to internalize the essence of what I've just shared. This illustrates the impactful work we are talking about. And remember, the client wasn't even aware of this amusing yet dysfunctional belief before the process. It's crucial to note that this example pertains to a client already engaged in positive behaviors. In other cases, a client might struggle with motivation, citing lack of desire to go to the gym as the reason. In such instances, restructuring underlying beliefs can ignite the motivation to act, and subsequently, it can impact weight management. Values, on the other hand, represent what we aspire to, but conflict between values may arise. For instance, valuing honesty and helping others could clash if helping someone requires telling a lie. Identifying, prioritizing, and creating a value hierarchy can assist clients in navigating these internal conflicts. Often, clients aren't consciously aware of their beliefs and values, making it challenging to address them. That's when our processes come into play. We use hypnosis to help them recognize both their conscious beliefs and unconscious beliefs and values, assisting them in dealing with and addressing these elements. Next, moving on to the positive intention or secondary gains. This concept is intriguing because many therapeutic approaches touch upon the concept of secondary gain, but few provide a clear method to identify and address unconscious secondary gains. Take the example of someone struggling to quit sweets. Their challenge may be rooted in childhood experiences where sweets are associated with love and affection from their parents. This association creates a deep connection between feeling loved and eating sweets. So even when they are alone and emotionally down, the natural inclination is to turn to sweets for comfort, as it fulfills their need for love, albeit temporarily. This positive intention, often unconscious, hinders the desire to quit sweets. In short, positive intention refers to the unconscious benefit our system derives from a behavior, which many a times we are attempting to change. The key is to use specific processes that connect with the unconscious, making clients aware of these positive intentions and helping them address these underlying motivations. Moreover, these processes empower the client to seek help of the unconscious to devise new functional strategies that align with positive intention. This approach takes the burden off the client in figuring out solutions consciously. In the chat, I see requests for names of techniques that can be used to help clients address different aspects of these layers. You know what? That is exactly what I am moving on to next. So, now that you understand what are beliefs, values and positive intentions, what are these processes that we can use to work with them? For beliefs, there are several processes you can utilize, such as belief change, levels of transformation, and some even metaphorical processes. These techniques help clients explore and change their beliefs. When it comes to values, the focus is on recognizing internal conflicts. Hypnosis and metaphors can uncover these conflicting values. Parts integration is a helpful tool for establishing a clear hierarchy of values and integrating them together. In many cases, levels of transformation can effectively address both beliefs and values. Working with positive intention involves processes like subconscious talk and end-step reframing from neurolinguistic programming. These methods empower clients to not only explore their positive intentions, but also to find alternative ways to fulfill these intentions, reducing their dependence on the original behavior. Sometimes, as you work with these issues, you might discover that they stem from deeply buried intense emotions resulting from past experiences, which could include trauma or even repressed memories. All of this forms the foundation for the next layer in therapy. To address this layer, we employ a range of techniques that combine principles of psychoanalysis with methods we have discussed earlier. These include inner child work, regression, time travel, kinesthetic disassociation, Ho'oponopono, hypnodrama, and many more. Depending on the specific trauma, suppressed emotions, or past experiences we are dealing with, we select the appropriate technique to help clients address these issues. Once this layer is addressed, it leads to the resolution of their beliefs, values, and positive intentions. As a result, their thoughts and feelings are positively affected, ultimately leading to a transformation in their behaviors. These layers constitute the essence of the cognitive hypnotic psychotherapy approach. Different psychotherapeutic methods aim to address each of these layers. Solution-focused brief therapy and positive psychology often focus on addressing lack of clarity, skills, and resources by emphasizing clients' actions. Cognitive behavioral therapy typically delves into managing thoughts and emotions, while rational emotive behavior therapy zeroes in on beliefs. Positive intention is a core concept in neurolinguistic programming. Past experiences, suppressed emotions, repressed memories, and trauma find attention in therapies like eye movement desensitization and reprocessing, that is EMDR, emotional freedom techniques or EFT, inner child work, Ho'oponopono, as well as psychoanalysis and psychodynamics. Cognitive hypnotic psychotherapy brings all of these elements together, creating a comprehensive approach that surpasses individual methods. It amalgamates the best from each, with the soft C framework providing the structure and a unique integration of techniques rooted in profound understanding of the conscious and unconscious. Let's circle back to the summary, evaluation and assignment phase. Summarizing is all about distilling everything into one or two lines, aligning with the client's understanding. It may echo the outcome statement, but sometimes it may also vary. So we encourage the clients to summarize in their own way, offering them flexibility. After summary, next is evaluation. Every session starts with an evaluation of the progress that the client has made between the sessions. Despite the internal shifts in thoughts, feelings, beliefs, values, positive intentions, or even memories, we firmly believe that tangible external changes in the client's life are crucial. This includes shifts in behaviors and applied strategies, and also them moving closer to their desired future. Without these visible changes, we feel the work may fall short. Finally, A stands for assignments. Assignments in our approach is different from traditional therapy. We don't burden the clients with excessive homework. Their primary task is observation. During sessions, we help clients address 3 identified triggers or tasks, and throughout the week, the client observes the changes in those tasks and in their ability to handle those triggers naturally. We believe that change should happen naturally and should be sustainable. Every week, clients returns with feedback on the 3 tasks or triggers that we worked on. If the client sees a positive outcome in these tasks and triggers, we proceed to the next set of tasks and triggers. If not, we explore deeper layers. For instance, if thoughts and emotions were tackled for 3 tasks in one session, and in the next session the client comes back and gives us feedback that 2 of them yielded results, but 1 didn't, we might delve into underlying beliefs, values and positive intentions for the one that did not give them the result. The client then observes the impact of the work that we have done with their beliefs, values, positive intention in the following week. This iterative process allows us to continually assess the success of our approach and adjust course if needed. This multifaceted approach ensures that clients not only have a structured plan, but also the flexibility to adapt and evolve based on their own unique journey. The Soft C framework is not just a set of steps, it's a dynamic, personalized guide that empowers clients to navigate their path to positive change. I hope you are beginning to recognize the power of the approach that we follow and the efforts and sincerity with which we have created this approach. Type yes in the chat box if you do. Once again, I am so excited to see all your responses. So, with this, we are reaching the end of this fantastic webinar, and I want to express my gratitude to each one of you for being a part of it. The Soft C framework and the Cognitive Hypnotic Psychotherapy approach is more than just a set of steps. It's a dynamic tool tailored to empower you on your journey towards positive change and developing skills so that you can help your clients do the same also. If you have any lingering questions or if something comes to your mind, now is the perfect time to ask me. Type in your questions and I'll do the best I can to provide you with the answers you're looking for. As we await any final questions, I want to extend an invitation. If you feel that a more personalized discussion could benefit you, or if you're interested in incorporating cognitive hypnotic psychotherapy approach into your practice, don't hesitate to schedule a meeting with me. I'm here to help you delve deeper into the specific queries. So, as I begin to wind up, while I look at the chat, I don't see any additional questions in sight. So, we'll be concluding our session now. But before you go, check your email. As a token of appreciation, we have prepared a special 5% discount coupon that we discussed about earlier. This coupon has a validity of 7 days. This code can be used for an extra discount when enrolling in our comprehensive course. Just to recap what awaits you in the transformative journey, you get access to pre and post online modules valued at 75,000 rupees, 300 plus hours of instructor-led live training valued at more than 15 lakh rupees, brand building actionable strategies valued at more than 25,000 rupees, multiple certifications, registration as a practitioner on the Meet Goal app, which opens doors for potential collaborations with us. Another opportunity for collaboration is through corporate coaching and training. You then get the money back guarantee, which provides you with a peace of mind. You also get access to lifetime support valued at 10,000 rupees per month at the minimum and a sense of belongingness. The total value of this comprehensive package is substantial. However, as a gesture of appreciation for your participation today, you can acquire all of this for just rupees 1,30,010 after applying the discount.
I'm Dr. Kishore Jha. I'm a medical postgraduate and I got enrolled for this course of cognitive hypnotic psychotherapy. And from level 1 and 4, if I have to say, it has been a powerful journey for me. Initially, I started with coaching and I have started getting results. I felt there were a few things which are a very important takeaway for me. One was soft C, which became the foundation of all my coaching. It brought in so much of clarity in not only in myself, looking at life, but at the same time setting goals for clients, making their future more clearer. That was something which I learned in level 1 and level 2. I felt it is too much. But then when I got into level 3 and level 4, then I understood there are so many tools which we can apply and actually which gives healing for the patient. How I say healing, the reason being is I have at the end of this course, we have ourselves undergone these therapies. And when we have undergone these therapies, we realize how we have been benefited. The conviction of this process going to work on client is so powerful now that because we are saying it this from our experience. First of all, that after the end of all my course, I feel sometimes it is the value that has been delivered is out of the box. It is so much of value in the amount that the HRs has been asking for is too less compared to the value that has been added. So for me, it is an over-delivered thing, much value. And in 3 words I have to explain, it's a life transformation process and course. It has helped me immensely. And one more thing I would say is I have used this on my clients. And my clients have given me a feedback where they say that there has been a change, magical change has been put. So I'm deeply touched by all the mentoring that has been done by Nitin sir and his patience, his way of teaching. I wish I have that technique and the skills that he has, and I deliver and I can deliver the way he does things. So I'm quite happy that I am a part of iCharge. I feel blessed, and it's a strong recommendation for me to of course explore this course to the best. Thank you so much for all the opportunity to all my friends, colleagues, and Nitin sir. Thank you so much.
Thank you. Just to recap what awaits you in the transformative journey, you get access to pre and post online modules valued at 75,000 rupees, 300 plus hours of instructor-led live training valued at more than 15 lakh rupees, brand building actionable strategies valued at more than 25,000 rupees, multiple certifications, registration as a practitioner on the Meet Goal app, which opens doors for potential collaborations with us. Another opportunity for collaboration is through corporate coaching and training. You then get the money back guarantee, which provides you with a peace of mind. You also get access to lifetime support valued at 10,000 rupees per month at the minimum and a sense of belongingness. The total value of this comprehensive package is substantial. However, as a gesture of appreciation for your participation today, you can acquire all of this for just rupees 1,30,010 after applying the discount code. Thank you once again for being a part of this enriching session. I'm looking forward to the prospect of connecting with you further, whether through questions now or in our future interactions. Again, like I said, while I'm checking, there are no other additional questions, so I would close the session now, wishing you a wonderful day ahead and looking forward to seeing you in the workshop. Bye-bye. Take care. Bye-bye. Take care.